Under the Reports tab, we have a few different things. So clinical reports, health summary. The most useful ones for our purposes are going to be imaging. We have the blood bank report, anatomic pathology, and procedures. Also potentially useful is the health summary, which has a number of different things. These sideways carrots will expand this. So we select this. The most useful thing for inpatient medicine is to scroll down to this medication reconciliation. So this is going to bump this to the top of the list here. But again, that's under health summary, medication reconciliation. And this will put a side-by-side comparison together for your inpatient and outpatient medications. Interestingly, this is only showing inpatient medications, although as you can see, this says visit not selected, which is the status designation for outpatients. So I'm not entirely sure what this is showing us with this test patient, but IMP means inpatient, as this says. OPT means outpatient. So literally this would say basically the same thing. It would just say OPT here. So Doxena, one tab BID for constipation, and then right next to it, you would see inpatient, Doxena, one tab BID for constipation. So this is a really useful way to do your MedRec, when admitting or discharging a patient. Imaging is where we see all of our imaging tests. Pretty straightforward. We don't see the actual images themselves here, which we'll cover separately, but basically that's in Tools, CPRS Imaging, or PACS if you wanted to open PACS. But we'll cover those separately. This shows the report. As this is a test patient, there's really not much info in this area, but we do have a report here, which just says this was done in an outside facility and scanned in. I will point out there's a little sort of picture art icon that will show up right here next to the date in this list, and that will designate whether there is an image available to view for this study or not. So before you open the imaging viewer, which can take a minute, it's good to just double check that while you're looking at the reports, because you can tell very easily if there will be information there for you to review or not. Anatomic pathology, basically the same as what shows up under the labs tab. Blood bank report, basically the same as what shows up under the labs tab. Procedures, a number of procedures show up here. As I mentioned, echoes are in the consult section. They're also listed here. We have the same list of echoes with the same interpretation summary, but other procedures like PFTs, colonoscopies, and EGDs will show up in this area. So that is where we would go to look for the reports for those tests.